Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then 47 XXY phenotype with features of hypogonadism. Likely diagnosis is Klinefelter syndrome. Always 46 XXY is Klinefelter syndrome.
47 XXY is Klinefelter syndrome.
Then a girl with primary amenorrhea with normal ovaries and absent internal genitalia and normal external genitalia. Most likely diagnosis is Mayer-Rokitansky-Kuster-Hauser syndrome. Why? Because the genitals are normal ovaries but absent internal genitalia. That is Mullerian agenesis is there. So as a result, this is Mullerian agenesis. So the internal genitalia are not formed. So the defect is Mayer-Rokitansky-Kuster-Hauser syndrome. Then a 19-year-old patient comes with the complaints of primary amenorrhea. She has well-developed breasts and pubic hair. Well-developed breasts and pubic hair. There was absence of vagina and uterus. Likely diagnosis is well-developed breast, pubic hair, amenorrhea, primary amenorrhea, absence of vagina and uterus. So here, well-developed breast, pubic hair is also well-developed. Well-developed breast and pubic hair. So everything is normal except that there is no uterus and vagina. So obviously uterus and vagina are formed from Mullerian duct. If there is Mullerian agenesis, obviously they will be absent. Then, young male presents with delayed puberty and decreased FSH, LH and testosterone. Which of the following is not possible? So young male with delayed puberty, decreased FSH and LH and testosterone. So Klinefelter syndrome. Sorry. Yeah. First we will see Klinefelter syndrome. Klinefelter syndrome, there will be increased FSH and increased LH, not decreased. Okay. So this is not possible. Kallmann syndrome can be present because there will be GnRH cells are defect. So as a result, hypothalamus does not produce GNS. So as a result, there will be decreased FSH and decreased LH will be seen, which will result in decreased testosterone. This is true. It can be constitutional delay also. DAX1 mutation can also be there. So this is the one which cannot be there. Next.
thank you and thank you for watching.